Hi guys! So today I'm going to talk about pituitary adenomas and hyperprolactinemia, and preface everything that I have to say by saying that I'm not a medical professional. I'm simply a wellness and health enthusiast. A big part of the reason that I wanted to talk about this is because I haven't really found a lot of videos on here about this, especially personal experiences, so I wanted to expand a little bit more on that. If you see me looking down a lot, I'm just looking at my notes. I've kind of laid this video out. Basically, what is a pituitary adenoma, that I'm going to discuss different symptoms and how they present themselves, then treatment options, and then lastly, I'm going to talk about my personal experience with this and how I'm handling everything. So let's get started. So a pituitary adenoma is basically an accumulation of a bunch of cells on the pituitary gland that are not supposed to be there. So essentially they form a growth or a tumor that essentially about 95% of the time turns out to be benign. They're not life-threatening in most scenarios. I'll discuss some outliers in a moment. And there's two terms for this. So they would classify as a macro, and under 1 centimeter it's a microadenoma. This is coming not just from me, but from a lot of people who I've spoken to and read their stories who deal with this. The actual size of the adenoma has nothing to do with how you're feeling. Your symptoms aren't going to be so much worse depending on the size, and that's actually a misconception that I've heard that a lot of physicians are kind of trained to, you know, when they're looking at these things in MRIs, we tend to think that the bigger the tumor is, the worse it is, but in our case, the pituitary is already so small, it's the size of a pea. Any kind of tumor on there that's not supposed to be there is going to cause some problem. The pituitary sits in something called the sella turcica, and so there's not really a lot of space for anything else to be there. So a lot of the symptoms of pituitary problems are essentially hormonal imbalances, and that's because the pituitary gland is also known as, I think they call it like the master hormonal something, because it's essentially the first and second step in all of the hormonal processes in the body. They control so many things, so and what's interesting is that hormones all work together. So if one hormone is too low, it'll impact all the other ones that are related, but I won't get too much into that. The way that these tumors are oftentimes found are due to people start having vision problems. So this is more in the terms of a macroprolactinoma. Basically, the tumor is large enough that it impacts on the optic chiasm, and as you can see in the graph, you know, that's the nerve that sends all of the visual signals down to our eyes. So once that gets, you know, impeded on, you're going to start having some vision problems, and that's why a lot of the people that have them tend to be in the older age groups, because these tumors not only take many years to form, but, you know, visual disturbances, you know, we don't often think like, oh, it's a pituitary problem. It's usually just, you know, a vision problem, and that is what it is most of the time. So when I'm talking about hormones and vision issues, you know, pituitary tumors really are more of a rarer case, so I don't want to scare anyone. You know, if you think you may have a pituitary adenoma, this video is definitely more for someone who has been diagnosed or someone who has hyperprolactinemia, which is a high prolactin level, a high serum blood prolactin level. So in women, there is a subgroup of, you know, all these people with pituitary adenomas who are younger women, and by younger, I mean women who haven't reached menopause yet. And the reason being are because the symptoms of hyperprolactinemia or having a pituitary adenoma often mess with the sex hormones of the body. So in men, testosterone, in women, estrogen and progesterone, and any imbalance of estrogen and progesterone in relation to each other is going to cause things such as cessation or irregular menstruation, galactorrhea, which is, you know, secretion of breast milk when you're not pregnant or breastfeeding. A large part of pituitary adenomas are prolactinomas because they are producing too much prolactin hormone. And these are really easy to find because essentially, you know, if you go to the doctor and they do, you know, like a basic hormonal profile on you, if they find your prolactin level is too high, then that is almost, you know, depending on your symptoms, it's enough of a case for them to refer you to get an MRI, and then, you know, you'll find your pituitary tumor. And another big part why I wanted to make this video is because there's a lot of fear around, you know, potentially having a pituitary adenoma. There's a lot of fear around getting an MRI even because, you know, there's all these horror stories of the contrast and the IV and all of these harmful things, and I just want to tell everybody who has one or just found out they have one, that it's okay. You know, don't worry. For many people, this is kind of a lifelong management kind of condition, but that's not to say you're gonna be dealing with your current symptoms your whole life. It's just to say that it's manageable enough to where there are steps that, you know, you and your medical professional can take, and you can lead your normal, fulfilling life. Back to the symptoms of a pituitary adenoma. Basically, any symptom of hormonal imbalance that you can think of can present itself as a, you know, symptom of a pituitary tumor, because their pituitary does regulate and produce so many hormones. So if you have, and by hormonal issues, I mean either too little or too much secretion of these hormones, hyposecretion, etc. What's interesting is that 1 in 10 people will actually develop one of these tumors throughout their lifetime. They just will never actually experience any symptoms from it. So there were some autopsies that were done on people, but it's about 10% of the population that has a prolactinoma. So, you know, after you basically hit menopause, and this applies to men too much prolactin doesn't cause a bunch of issues for you to really be worried about, and it's very easily treated with medication, which I will talk about next. So what are the treatment plans? So the treatment really depends on case-by-case scenario. There is no one medication treats all, even though it seems like, you know, if you've done your research, perhaps it seems like, oh my gosh, there's only a couple medications that I can take, so I'm bound to experience all these side effects if I'm taking it for life and all of this. Don't worry about that. I definitely don't think that's a good way to start thinking about it, because that's definitely how I felt at first. Basically, for microadenomas, the treatment is medication. The focus is going to be to shrink the tumor, because certain medications such as cabergoline and bromocriptine are very effective for this. They regulate basically your prolactin levels. They, you know, make them very, very low, and that prevents the tumor from growing and can actually shrink them in a good amount of people. Cabergoline is what's given to people with microadenomas most of the time, and definitely people with prolactinomas, regardless of the size. This is the medication that you're going to want to be on and that they're going to put you on. However, if you have a macroprolactinoma that was found due to vision problems, or if just on the MRI they find that it's impinging too much on the optic chiasm, then they will decide to do something that's called transsphenoidal surgery, and they'll go through your nose, and then they'll remove the tumor through there. Rarely do they need to do like a full-on, you know, craniotomy. That's very rare. There are exceptions, and the only exception to this is if you suffer from Cushing's disease. And Cushing's disease is basically a syndrome where there's too much cortisol in the body, too much cortisol hormone. And cortisol, as you heard, is the stress hormone. And pituitary tumors can do this regardless of the size, macro or micro. And this cortisol is dangerous because it regulates, you know, our sleeping patterns, our stress patterns, our mental health, you know, how weight is distributed on the body. It can cause a lot of fatigue, tiredness, it causes people to gain weight all around their abdomen area. It causes thinning of the skin. It causes some skin disorders such as eczema or psoriasis, you know, thinning of hair, scalp hair loss. It's really something that needs to be taken care of because it is actually fatal. So Cushing's disease is actually one of the only two disorders that exist that we know of yet that actually cause a person to gain weight regardless of what they do. So this is something that needs to be taken care of. You know, there's a lot of other issues besides the physical aspects of Cushing's. There's a lot of internal issues that basically can only be treated with surgery and removal of the tumor. Well, what's good is that you know, once you do get your tumor removed, I have read so many stories of people's lives just getting transformed, you know, because for years, this is the one thing about pituitary tumors. It takes years sometimes for them to manifest, for the symptoms to really come together. Sometimes you can have a few symptoms for a long time, and they're such general symptoms. Like, you know, for example, with me, one of my symptoms was menstrual irregularity. And as you all know, if you're here because of my PCOS videos or of my supplement videos, you know about polycystic ovarian syndrome, and if you suffer from it yourself, pituitary tumors are basically one of the only things that can mimic PCOS so much that a lot of women get diagnosed with PCOS first for years before they find out they actually have a pituitary tumor. And you can have both. It's not one or the other. I have both. So that isn't to say that if you have PCOS that you should be on the lookout to see if you have a tumor somewhere. That's definitely not the case. That's always go with what's more likely from a statistic point of view, and just overall, just take it from me. If I've learned anything, just go with what's more likely and try not to freak out too much, because this is very manageable. You're gonna be okay. And I do want to talk a little bit, so back to Cushing's. While you're waiting for the surgery, they will put you on something called ketoconazole, and that's a medication that basically, lowers your cortisol enough until you get your surgery date. And surgeries happen very quickly once you're diagnosed with Cushing's through blood tests, salivary cortisol test, maybe urinary cortisol tests, and a dexamethasone suppression test. You're basically on your way to get surgery as soon as possible. And essentially, I was tested for Cushing's, and thankfully I do not have Cushing's, but even after that, there is a subgroup of population that really do believe that tumor removal is the way to go, and that that's the way that they're going to feel better, and that all their symptoms are going to go away, and that their life's going to change tremendously. But transfenoidal surgery is very, very risky, and that's because of what I mentioned earlier. The pituitary gland is so small that unfortunately I have read of a lot of cases of people who get the tumors removed, but then they end up with other complications such as diabetes insipidus, or they end up having to be put on hormonal replacement therapy for the rest of their life because the pituitary is so small and so easily damaged. However, what's great is that regardless of what happens, there is treatment for everything. So even if you get the tumor out and something, was a little damaged, you can be put on hormones. That's not the ideal. So definitely, if you don't have Cushing's, just be patient with the medication. Be patient with the cabergoline, the bromocriptine, whatever it is that your physician decides to put you on, your endocrinologist. Just be patient with it. And I do want to talk a little bit about natural treatments. So, as you guys know from my channel, I am very much, into experimenting and trying out holistic and natural ways to get better and feel better and all of that. However, when it comes to these sorts of things, there really are no natural alternatives and natural routes. It's really too tricky. If you go on the Facebook groups, on the Reddit groups, anywhere that discusses natural treatments, you are going to come across names such as Vitex chasteberry, perhaps even frankincense for general tumor removal of any kind. And I just want to say that there really hasn't been any evidence, and even just from the people that I've talked to, a natural treatment isn't really an option, isn't really something that exists out there. When women are trying to conceive, they will sometimes be put off some of the medications to treat these tumors, but it's for a lapse period of time. Trying to conceive to actually conceiving a child, there's no natural treatment that is going to shrink the tumor and make it go away. All that you're doing sometimes is just symptom relief, and that's not what we want. We don't just want symptom relief. We want something that's really going to get to the root cause of what is causing your issues, and that's medication. You're going to have to take medication for these issues. So I just wanted to put that out there. In case I get comments, asking about natural ways. There are natural ways to relieve your symptoms. So for example, if your physician decides to put you on cabergoline, but you're still, after a couple months, you're still experiencing some other things, and they want to put you on other medications that are meant to just, stabilize symptoms, then, for those, if you're not getting symptomatic relief, then you can look to other natural methods. But for actual tumor shrinkage, you're going to want medication. And some of the side effects of cabergoline and bromocriptine are impulsive behavior, headaches, fatigue, especially the day that you take it. Some people take it twice a week, some people take it once a week, and depending on the dosage that you have, you may present more or less symptoms. There's people that don't have any symptoms at all. I'm one of these people. These people are more abundant than you would think. And I'll talk about that in a little bit. What's great is that most of these symptoms tend to taper off after your body gets used to the medication. And a lot of these symptoms aren't really due to the medication itself, but due to the drastic change in your hormone levels in your body And that's a good thing, because your hormones, whatever hormones you were tested for that were in balance, are going to gradually get back to their own balance. And by gradually, I do mean over a period of time. It can take 6 months, 1 year, just give it time. And if you are having like a lot of complications, it's interacting with your work life and your everyday life, then do seek a physician for that, as you guys know. But overall, medication is pretty safe. A note on that impulsive behavior, I think that's really interesting. I remember I was reading this guy's story. He posted on the Pituitary Tumor Group, and he was like, you guys, I find that I'm gambling away all of my money whenever I take my medication. He's like, and I get super horny and all these things. And it was really funny. It was like a very funny post. But I noticed that the day that I take my medication once a week, I do want to buy things. Like, I find myself online shopping more, and once you notice a pattern, then you can start to like work around it. Last but not least, I want to talk about support, because that's what some of you guys are here for. That's why you guys clicked on this video, and I'm here to tell you that you really have to be careful. If anything, just be mindful. And a pituitary tumor is definitely going to show you how to listen to your body, how to become more aware of what affects you. But also, a word of caution, the Facebook groups are great for, meeting people, reading about stories, asking for advice, and like how people deal with things, but it's not so great for anticipating what is to come. I don't want you guys to worry too much about the future, because your physician can tell you that, this is very manageable and that you're going to be fine. But Facebook groups, they have a tendency, and I see this not only in the pituitary groups, but also in the PCOS groups. A lot of people start to attribute all of their problems, all of their health symptoms on this little tumor. And yes, this tumor causes a lot more havoc than you would imagine. But you can't forget about, the rest of your health. How are you eating? How are your stress levels? How are your relationships? What is your body trying to tell you? Like I said, you will definitely build a better relationship with your body, a lot more sensitive. And I really want you guys to, if you can, practice mindfulness and appreciating your body and what it does for you. Something that is really sad and kind of baffles me, because I've taken part in this too, is basically we really start to blame our bodies and get frustrated with them when our health, takes a turn. And let's say if you have Cushing's, for example, let's say that you are just gaining all this weight and there is absolutely nothing you can do about it, and you're waiting for your surgery day, or you're waiting and you just feel like shit, you feel tired all the time. Don't hate your body for it. If you're seeking treatment, give it time, give it patience. Do what you can. Research other things that people do. A lot of people do very specific diets when they're on this, because in the older groups, a lot of people have this tumor, also have autoimmune disease, and it's not a causational relationship, but it's just an interesting thing that I've seen a lot of. And so a lot of people tend to go towards diets that are anti-inflammatory, or they go on low-carb diets to help with insulin resistance, and they feel a lot better. So have their tumors shrunk? Perhaps they have, perhaps they haven't, but they feel better. So there are ways for you to treat your symptoms in a way that's going to allow you to lead the life that you want. But definitely, it doesn't help to get frustrated with your body. I remember, there were definitely days where I was just so in shock that my body was doing all of this. I thought I had treated it so well, and I was trying so hard, and I just wasn't really seeing relief. And I just wasn't being patient, and I was comparing my health to the health of other people, and you can never know how somebody is feeling, okay? On the outside, it's gonna look like nobody has health problems, and nobody has, this goes for anything, nobody has as many financial issues as you have, nobody is as lonely as you are, nobody is as this and that. When it comes to health, do not compare, focus on yourself, take it day by day, and be vocal, be your own health advocate. Seek a second opinion. If you're not happy with the way your physician is going about things, and I mean your physician, not the medication, but if your physician, if they're not empathetic enough, if they have poor bedside manner, go and seek other people. Definitely, I had to get insurance, and it was a big financial stress for me, especially being in college. But I don't regret it at all, because now I have a team of doctors, you know, who I've had a lot of bad experiences, but I've also had a handful of good ones. And because of that, you know, I'm here today and I'm talking about health and all of that. So just be patient. There is also a group of people with autoimmune and pituitary issues that practice meditation, and a lot of us have cortisol issues. Even if you don't have Cushing's, a lot of people with tumors and autoimmune disease have cortisol, you know, kind of regulation issues, because their body is already under this stress, and then any outside stress just kind of piles up on that and doesn't really help the whole cortisol situation. So a lot of us do meditate, a lot of us do, you know, find ways to, like I said, ways to help our symptoms that are sustainable in the long run. So thank you guys so much for watching. If you have any questions or just want somebody to talk to, you need some support, feel free to reach out to me. If you are in Texas, then I really recommend going to MD Anderson in Houston. My endocrinologist is Dr. Weitzman, and there's another endocrinologist that I can also recommend that are just fantastic. And it not just the physician care, but just their whole system, the way it's set up, just absolutely amazing. I'm so happy with it. One thing that I forgot to talk about was my actual experience and how I found out that I had a pituitary adenoma. So the symptom that brought me into the clinic was actually hair loss. And to this day, I have no idea if the hair loss is actually related to the tumor, or the hormones of the tumor kind of messed up, or if it's due to PCOS. I actually to this day don't know. So you guys are on this journey with me now, and you can see my updates, and I'll let you guys know what's going on with that. But I went in because of hair loss, and you know, I had a history of irregular periods, and my doctors were like, oh, you know, she probably has PCOS. One of my ovaries, they did a ultrasound, it had too many follicles, too many cysts on one of them, so it was really pointing to PCOS. Like I said, PCOS can be mimicked by pituitary tumors. But they measured my prolactin level and my DHEA-S, and the prolactin came back slightly elevated. They told me, wait a little while, come back. I went back 6 months later, and they saw that it had doubled, so that's when they were like, alright, let's get you checked out, let's get you an MRI. My doctor didn't really say anything. I wrote her this long letter, and I remember she just couldn't empathize with me at all. She was so, I don't want to say rude, but she didn't validate my struggle, essentially. At the time, it really upset me. So she told me, get an MRI, it could explain all of your symptoms, and that was it. I got the MRI, and then she messaged me and she was like, you have a tumor, would you like a referral to an endocrinologist? And I was just shocked. I was like, I have a tumor and you're not telling me anything about it, and you're asking me if I want a referral. Of course I want a referral. And so basically they found it because of the hormones, right? Prolactin, and my DHEA-S was elevated. Now that I've been on cabergoline for about 6 months, my prolactin level went down immediately. Within 2 weeks it was low. Like, cabergoline has been very effective in lowering the prolactin levels, so that's great. And I did feel a bit tired, and I had some headaches. I would feel very dizzy when I would stand up. You know, at the beginning, but now I don't feel it. I take cabergoline once a week and I'm fine. Besides the impulsive behavior I talked about earlier, I'm basically doing really well. And if you're here because of my hair videos, I just want to let you guys know that this is a wig. Okay, my hair hasn't really improved a lot, and it's likely hormonal. It's likely due to PCOS. It might be due to the tumor, who knows, but I've kind of learned to just live past it. And so I'm wearing her today just for the video, but you can see my other video where I talk about a topper, and that's usually what I wear just on the daily. This was just kind of like a, you know, I just felt like it. But yeah, so that's how we found out that I had one. And mine is 5 millimeters, so it's a microprolactinoma. And actually, that's the one other thing my doctor told me when she saw that I had one. This is a general practitioner, by the way. She was like, it's 5 millimeters. They're not going to operate on it. Do you want a referral? And you know, I did go through a phase definitely where I just wanted the tumor out. That's initially why I went to MD Anderson, because I wanted a second opinion. I wanted someone to tell me, we don't really do this, but we'll remove the tumor for you because it's causing you all these problems. And that's not what happened. And guess what? Those problems weren't actually due to the tumor, you know? So I've kind of come to peace with not being a candidate for removal of it. And now that I've read all the stories about what happens to a lot of people after they get it removed, I don't really want to get it removed anymore because it is definitely tricky. But MD Anderson does have a very, very high success rate with these tumors. They have really, really talented neurosurgeons, and so that's why I went there. So that's why I recommend going there if you're down south. There's also Dr. F in California. I will put his information below. He is basically like the #1 physician that people with tumors go to when they really, you know, have the means and the reasons to travel across the country and even the world to go to California, because he's a pituitary specialist. He's a genius. All I had to say, I'm basically, you know, I'm taking it, like, I don't think about the tumor most days at all. I actually never really think about it. I just wanted to make this video for you guys, especially for you younger people that, you know, none of your friends have this. You can't find any YouTube videos about this by a young person. That's why I'm here. So like I said, reach out to me if you want, and thank you so much for watching.